Did you know that 92% of diabetics are deficient in at least one critical mineral essential for blood sugar control? This startling statistic from the Journal of Diabetes Research explains why so many struggle with glucose management. The frustration is real. Despite following medication protocols and making significant diet changes, blood sugar readings continue to fluctuate unpredictably. Morning numbers remain elevated. Post-meal spikes occur despite careful carbohydrate counting. Research has identified 3 specific minerals that can significantly improve glucose regulation when restored to optimal levels. These minerals work directly at the cellular level, enhancing how effectively insulin binds to receptors and how efficiently glucose enters cells. Addressing these mineral deficiencies could be the missing piece in diabetes management that conventional treatment overlooks. Without adequate levels of these minerals, the body simply cannot process glucose properly, regardless of medication, dosage, or dietary discipline. Mineral number 2 deserves special attention. Studies show it improves insulin sensitivity by up to 38%. Yet many diabetes medications actively deplete this mineral from the body, creating a counterproductive cycle that makes blood sugar control increasingly difficult. These 3 minerals could transform your diabetes management efforts starting today. The connection between minerals and diabetes management represents one of the most overlooked aspects of blood sugar control. While medications target blood glucose directly, they often fail to address the underlying mineral deficiencies that make proper glucose metabolism impossible. Minerals function as essential cofactors in glucose metabolism. This means they activate the enzymes and cellular processes required for insulin production, insulin sensitivity, and glucose transport into cells. Without adequate mineral levels, these processes become significantly impaired. Diabetes creates a dangerous cycle regarding mineral status. The elevated blood sugar and increased urination associated with diabetes cause greater mineral excretion through the kidneys. This creates progressively worsening deficiencies, making blood sugar control increasingly difficult despite medication adjustments. Standard blood tests often miss these critical deficiencies. Serum blood tests only measure circulating minerals, not cellular concentrations, where these minerals actually perform their functions. A person can show normal levels on standard tests while experiencing significant cellular deficiencies. These essential minerals work on 3 critical levels in glucose metabolism. First, they support proper insulin production in the pancreas. Second, they enhance insulin sensitivity at cellular receptor sites. Third, they facilitate glucose transport mechanisms that move sugar from bloodstream into cells. The conventional approach to diabetes management rarely addresses these mineral requirements. Medical education typically includes minimal nutrition, training, and pharmaceutical treatments dominate diabetes protocols. This leaves most diabetics with unaddressed mineral deficiencies that undermine their best efforts at blood sugar control. Let us start with the mineral that directly impacts insulin ability to work effectively at the cellular level. Mineral number 1, chromium. Chromium serves as a critical component of glucose tolerance factor, or GTF, a molecular complex that enhances insulin action at the cellular level. This trace mineral essentially functions as the key that helps insulin unlock cells to allow glucose entry, making it fundamental for blood sugar regulation. At the cellular level, chromium increases the number of insulin receptors and enhances insulin binding to these receptors. This directly improves insulin sensitivity, allowing your existing insulin to work more efficiently rather than requiring more insulin production. Research published in Diabetes Care demonstrated remarkable results. Participants receiving chromium supplementation experienced up to 38% improvement in glucose tolerance compared to placebo groups. Additional studies show chromium can reduce fasting blood glucose by an average of 21% when deficiencies are corrected. Modern food processing has significantly reduced chromium content in the typical diet. Refining grains removes up to 98% of chromium content, while high-sugar diets increase chromium excretion through urine, creating a perfect storm for deficiency. Many symptoms of chromium deficiency mirror diabetes progression: increased thirst, fatigue after meals, brain fog, and difficult weight management. This often leads to increasing medication doses when addressing the underlying deficiency might be more effective. Robert from Chicago discovered this connection at age 67. Despite following his medication regimen precisely, his A1C remained stuck at 7-8%. After testing revealed low chromium levels and 3 months of targeted supplementation, his A1C dropped to 6.5%, the lowest in 5 years, allowing his doctor to reduce his medication dosage. Optimal food sources include broccoli, green beans, grape juice, whole grains, and nutritional yeast. However, supplementation often becomes necessary to achieve therapeutic levels for blood sugar control. For supplementation, chromium picolinate shows superior absorption in most research, though chromium polyneuropathanate also demonstrates good results. Research supports dosages between 200 and 1,000 micrograms daily, with higher amounts generally needed for those with established diabetes versus prediabetes. Those who benefit most include individuals with insulin resistance, prediabetes, in type 2 diabetes, particularly those experiencing carbohydrate cravings and post-meal energy crashes, while chromium helps insulin work better at the cell surface. Our next mineral plays a crucial role in how your body processes carbohydrates inside the cells. Mineral number 2, magnesium. Magnesium stands as perhaps the most critical mineral for diabetics, involved in over 300 enzymatic reactions related to glucose metabolism. This mineral activates enzymes that allow cells to properly process carbohydrates and use insulin effectively, making it essential for blood sugar regulation. Alarming statistics reveal that up to 75% of diabetics have significant magnesium deficiencies. Even more concerning, research from the Journal of Clinical Endocrinology and Metabolism demonstrates that magnesium deficiency can precede diabetes, suggesting it may be a contributing factor to disease development. Many common diabetes medications actively deplete magnesium levels. Metformin increases magnesium excretion through the kidneys, while insulin therapy can drive magnesium from bloodstream into cells, masking deficiencies on standard tests while creating cellular imbalances. Multiple studies establish a direct relationship between magnesium status and A1C levels. Research published in Diabetes Care found that for every 50 mg increase in daily magnesium intake, diabetes risk decreased by approximately 15%. Additional studies show that correcting magnesium deficiency can improve insulin sensitivity by 25 to 30%. Magnesium provides dual benefits for blood sugar control. It enhances insulin secretion from the pancreas, while simultaneously improving insulin receptor sensitivity on cells throughout the body. This two-pronged approach makes it exceptionally valuable for comprehensive glucose management. Low magnesium status directly contributes to common diabetic complications. Studies link magnesium deficiency to increased risk of neuropathy, retinopathy, and cardiovascular disease in diabetics, suggesting this mineral plays a protective role throughout the body. The stress-magnesium-glucose connection creates another harmful cycle. Stress depletes magnesium. Low magnesium increases stress hormone production, and stress hormones raise blood sugar levels. Breaking this cycle through magnesium restoration can stabilize glucose readings, particularly during stressful periods. Margaret from Florida experienced this transformation firsthand. At 72, she suffered from persistent nighttime leg cramps and morning blood sugar readings, averaging 160 mg despite medication compliance. After 6 weeks of magnesium supplementation, her leg cramps resolved completely while her morning readings dropped to average 128 mg. Her endocrinologist noted improved nerve function tests at her next visit. Optimal food sources include dark leafy greens, pumpkin seeds, beans, nuts, and whole grains. However, most diabetics require supplementation to correct established deficiencies. For supplementation, highly absorbable forms include magnesium, glycinate, malate, and citrate. Avoid magnesium oxide, which has poor bioavailability. Research supports dosages between 300 to 400 mg daily, ideally split between morning and evening doses for better absorption and utilization. Those who benefit most include diabetics experiencing stress-related glucose spikes, muscle cramps, sleep disturbances, or signs of neuropathy. Improvement in these symptoms often indicates successful magnesium repletion. While magnesium improves insulin function, our final mineral works differently, by protecting pancreatic beta cells from oxidative damage. Mineral number 3, zinc. Zinc plays a fundamental role in insulin production, storage, and secretion from pancreatic beta cells. This mineral is required for insulin crystallization within the pancreas, allowing for proper storage and regulated release when blood glucose rises. Without adequate zinc, insulin production becomes compromised at the most basic level. Beyond insulin production, zinc provides critical protection for pancreatic beta cells against oxidative damage. Diabetes creates increased free radical production that can destroy these insulin-producing cells. Zinc activates antioxidant enzymes that shield beta cells from this destructive process, preserving insulin production capacity. Research published in the Journal of American College of Nutrition demonstrates that zinc supplementation can significantly reduce fasting blood glucose levels and A1C in type 2 diabetics. A comprehensive meta-analysis of 25 studies confirmed that zinc improves both short-term glucose control and long-term A1C values when deficiencies are corrected. Diabetics lose substantially more zinc through increased urination than non-diabetics. Studies show up to 60% greater urinary zinc excretion in poorly controlled diabetes. This creates a problematic cycle where diabetes causes zinc loss, and zinc deficiency worsens diabetes control. Many signs of zinc deficiency are misinterpreted as diabetes progression. These include delayed wound healing, decreased immune function, altered taste perception, and reduced night vision. Addressing zinc status often improves these symptoms while simultaneously enhancing glucose control. Thomas from Ontario experienced this connection directly. At 64, he struggled with a foot ulcer that refused to heal despite standard diabetic wound care protocols. Testing revealed significant zinc deficiency. After 8 weeks of zinc restoration, his wound finally began healing, and he noticed his fasting blood glucose dropped from averaging 160 mg DL to 135 mg DL without medication changes. Optimal food sources include oysters, beef, crab, chicken, pumpkin seeds, yogurt, and cashews. Since many diabetics follow plant-based or lower red meat diets for cardiovascular health, supplementation often becomes necessary. For supplementation, zinc picolinate and zinc acetate show superior absorption. Research supports dosages between 15 to 30 mg daily for diabetics. Importantly, long-term zinc supplementation requires balancing with 1 to 2 mg of copper, as high zinc intake can reduce copper absorption. Those who benefit most include diabetics with compromised pancreatic function, frequent infections, slow-healing wounds, or altered taste perception that affects healthy eating. Improvement in wound healing and infection resistance often serves as early indicators of successful zinc repletion. Now that you understand each mineral individually, let us examine how they work together synergistically for maximum blood sugar control. Implementation plan. These 3 minerals, chromium, magnesium, and zinc, work synergistically to create comprehensive blood sugar support. Chromium enhances insulin receptor sensitivity, magnesium activates glucose processing enzymes, and zinc protects insulin-producing cells while supporting insulin storage. Together, they address multiple aspects of glucose metabolism simultaneously. For optimal implementation, a strategic sequence yields the best results. Begin with magnesium, as it creates the foundation for proper enzyme function. After 2 weeks, add zinc to enhance pancreatic protection. Finally, introduce chromium to optimize insulin sensitivity. This gradual approach prevents overwhelming the system while addressing the most fundamental deficiencies first. Several testing options can identify specific deficiencies. Standard blood tests provide basic information but have limitations. For magnesium, request RBC red blood cell. Magnesium, instead of serum, magnesium for more accurate cellular status. Specialized functional medicine tests like Nutrivol or Oligoscan provide more comprehensive mineral assessments. Timing strategies significantly impact absorption. Take magnesium in divided doses, with a larger portion in the evening to support sleep. Zinc is best absorbed when taken at least 2 hours from high-calcium foods or supplements. Chromium shows optimal benefits when taken 30 minutes before meals to enhance glucose handling. James from Colorado implemented this comprehensive approach at age 59 after struggling with diabetes for 7 years. His fasting glucose consistently ran between 160 to 180 mg despite medication. After following this 3-mineral protocol for 4 months, his fasting glucose stabilized between 110 to 125 mg, and his A1C dropped from 7.9 to 6.7%. His endocrinologist noted significant improvements in his diabetes markers across the board. Several complementary nutrients enhance these minerals. Vitamin D improves magnesium absorption and insulin sensitivity. B vitamins support the enzymatic processes that require these minerals. Omega-3 fatty acids reduce inflammation that can interfere with mineral utilization at the cellular level. Watch for potential medication interactions. Chromium may enhance insulin action, potentially requiring medication adjustments to prevent hypoglycemia. Certain medications require specific timing separation from minerals, particularly calcium channel blockers, thyroid medications, and certain antibiotics. Positive signs that mineral supplementation is working include improved fasting glucose within 2 to 4 weeks, reduced post-meal spikes by 3 to 6 weeks, decreased carbohydrate cravings, better energy levels, and improved sleep quality. Laboratory improvements typically appear in A1C readings after 2 to 3 months. Cost-effective approaches include purchasing minerals in combined formulations specifically designed for glucose support, which typically offer better value than individual supplements. Look for professional-grade supplements that verify potency and purity through third-party testing, as quality varies dramatically between brands. Now, let us review important precautions before implementing this mineral protocol. Important precautions. While these minerals offer significant benefits, certain individuals should exercise caution with supplementation. Those with kidney disease require professional guidance, as impaired kidney function affects mineral processing and excretion. Individuals with certain cardiac conditions should also consult healthcare providers before supplementing magnesium. Several medication interactions require careful monitoring. Chromium may enhance insulin action, potentially necessitating adjustments to insulin or sulfonylurea dosages to prevent hypoglycemia. Magnesium can affect the absorption of certain medications including some antibiotics, bisphosphonates for osteoporosis, and certain blood pressure medications. When discussing mineral supplementation with healthcare providers, bring specific research articles demonstrating benefits for diabetes management. Ask for appropriate testing to establish baseline levels and monitoring protocols. Many conventional physicians appreciate patients who provide scientific rationale rather than simply mentioning supplements. Regular monitoring becomes essential when implementing mineral supplementation. Test blood glucose more frequently during the first 2 weeks to identify any significant changes requiring medication adjustments. Those on insulin or sulfonylureas should be particularly vigilant for signs of hypoglycemia as insulin sensitivity improves. Watch for signs of excessive supplementation. Magnesium excess typically causes loose stools, which indicate the need for dosage reduction. Zinc overconsumption may cause nausea or altered taste. Chromium has minimal toxicity concerns at recommended dosages, but very high doses may cause irritability or sleep disturbances. Specific medical conditions requiring supervised implementation include pregnancy, kidney disease, liver disease, certain cardiovascular conditions, and anyone taking multiple medications. These situations demand personalized approaches under professional guidance. Remember that minerals represent one component of comprehensive diabetes management. Continue following prescribed medical protocols, maintaining dietary guidelines, engaging in regular physical activity, managing stress, and getting adequate sleep. All factors that work synergistically with mineral supplementation for optimal blood sugar control. Now, let us conclude with specific action steps to implement this information effectively. Conclusion: these 3 essential minerals provide powerful support for blood sugar regulation through distinct mechanisms. Chromium enhances insulin sensitivity at cell receptor sites. Magnesium activates enzymes required for glucose metabolism. Zinc protects insulin-producing cells while supporting proper insulin storage and release. To begin implementing this knowledge, start with magnesium glycinate at 200 mg twice daily for 2 weeks. Then add zinc picolinate at 15 mg daily. Finally, incorporate chromium picolinate at 200 mcg before meals. This gradual approach prevents overwhelming your system while addressing fundamental deficiencies. Expect initial improvements in energy levels and post-meal blood sugar within 2 to 3 weeks. Fasting glucose typically improves within 3 to 4 weeks. Significant A1C reductions generally require 2 to 3 months of consistent supplementation, as this reflects longer-term glucose control. Always consult with healthcare providers before beginning supplementation, particularly if taking medications for diabetes or other conditions. Regular blood glucose monitoring helps track progress and identify any needed medication adjustments. Subscribe now for more evidence-based approaches to natural diabetes management. Hit the like button if you found this information valuable, and comment below with any questions about these essential minerals. Addressing these common mineral deficiencies could be the missing piece in your diabetes management puzzle, providing the foundation your body needs to regulate blood sugar effectively.